So what is it with these pressure gradients and the flow? When that cycle of the heartbeat is occurring, there is something that's taking place to the inner part of the heart with the blood and the flow. So, our ventricles, they contract and they relax, right? We've learned that. They contract and they relax. As that occurs, internal pressures, pressure within that ventricle is going to change. Now think about this. Ventricles contract, so they move in. They move in, they push the blood out. And if they do that and then they expand, is pressure not changing, going up and down in that ventricle? What about the atria? Same thing. They contract, relax, contract, relax. If we go back to that previous picture, and if we think about it in relationship to this syringe right here, something closing in or something opening up, we actually affect those pressures. Now, if those ventricles are relaxed, valves are open, blood flows in. Is that correct? Now, when they are relaxed, is the pressure high or low? It's low. But if blood begins to fill into those ventricles, what begins to happen to the pressure? The pressure is going to move up. So, when the pressures rise, the ventricle wants to contract. Valves will close. That's going to make the aorta open. If we're looking at the left side, like they're showing here, we look at the left side, and it's going to have that, when it contracts, it pushes it, causes that aortic valve to open, and blood go out. If the blood went out, what's going to happen to the pressure now in that ventricle? It's going to go back down. And if that goes back down, what's going to be able to happen with the blood that's now filled the atria? Flow back down. So while that ventricle was contracting, what do you think that atria was doing? Filling up. So, the valves, whether we're talking the bicuspid or the tricuspid, or the semilunar into the aorta or the pulmonary, they're governed by these pressures. Because if that pressure in the atria was high, but ventricle was low, that valve is going to be open. And then the atria pressure decreases, but ventricle increases. It made that bi or tri close. Is everybody with me? So these pressures, okay, that happen with the blood flow, they're going to govern the opening and closing of those valves. So, let's think back to our valves. If we look at the right side of the heart, which one? Tri or bi? Huh? My tricuspid. Okay? The left is going to be which one? The bi. All right? So, tricuspid, bicuspid. So now, if we begin to take notice of what they're trying to show us, note, huge amount of blood, huge amount of blood. Pressure is high here, but what here? Low. So my valves can open, my blood can begin to move from the atria to the ventricles. If that happens, what happened to the pressure in my atria? Goes back down, ventricle increased. Valves opened and closed according to those pressures. When it increased in the ventricles, that closed the bi and the tri, but opened the pulmonary and the aorta. Because the goal, what is the goal? Eject that blood from the heart. That's our goal. So, when we have that structure be governed by these pressures, that's going to be controlling their actual function. Things can go wrong. The valves, we can have what they term valvular insufficiency. This is just simply where the valves are just not functioning correctly. Any type of failure, okay? What it will normally do, it will generate a particular type of sound when the doctor or the nurse or whatever the case might be listening to your chest or taking the blood pressure. We have something called valvular stenosis. When something is stenosing, it's hardening. All right? So this is where the cusps, all right, the little flappy parts, stiffen. And that means they can't function correctly. Usually, it's a result of, as a child, suffering rheumatic fever. Don't hear a whole lot of that anymore, okay? But it does happen. And basically, it's the body attacking itself. So therefore, autoimmune. And it's attacking the mitral and the aortic valves. Can overwork the heart, make the heart enlarged, and that's not good. The heart murmur, okay, is usually a sound that gets produced when the valves go wrong. And like I said, they can usually hear that. All right? Everybody, for the most part, has a murmur. All right? But it's usually normal. When that murmur is very pronounced, when they're listening, that's when they'll probably want to do a little more testing. Okay? Something that tends to be a little more common than you would think, mitral valve prolapse. Which side of the heart am I talking about? I'm thinking about the bicuspid, and the bicuspid is on the left. So, let me think for a second. Where does the left pump the blood to? The systemic circuit. So that's blood getting pumped to all of the body. All right? This one is where the cusps, okay, they'll bulge, they'll move into the atria during ventricular contraction. So the blood that should be moving into the aorta Where's some of it going? Back into the A. We don't want no backflow. Okay? No, 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 no. We do not want the backflow. Valves are there for a reason, to control one-way flow of that particular fluid. It's about, 1 in 40 people. It's usually hereditary. Usually end up with thinking you're having a heart attack. You'll go, they'll check you out, and the more tests they do, they'll figure it out. And then you'll have to have a valve replacement for the most part. I think there are some medications, depending on how severe it might be, that can help. But for the most part, it usually ends up having to be the valve replacement. So what you begin to do is you begin to learn how to listen to the heart sounds. And when you listen, this is called auscultation. That is an actual description of what you're doing. Okay? Auscultation lets someone know you're listening. For the most part, there are 2 heart sounds. The first one, termed sound 1, okay? Louder, longer, does sound a little bit like low. Okay? It's occurring with the closure of the atrioventricular valves, the bi and the tri. Okay? We get turbulence in the bloodstream, and it's movement of the heart wall. These are sound. This is what is representing the first sound. The second sound, softer, not quite as long, and it's like duh, lub duh, lub duh. This one, semilunar valves are closing, creating turbulence and movements of the heart wall.
So why is it that you
Now, the pulse will be different than the actual listening, because the pulse is just simply that pushing out of the blood. So it's just that one motion. The listening, you're kind of, when you're trained, listening is basically 2 things. Either those atrioventricular valves or the semilunar. Atrioventricular would be blood moving from the atria into the ventricles. The semilunars would be the blood getting ejected into the aorta or the pulmonary. So it's 2 different events, whereas the pulse, just 1. Now there's a third sound. It should for the most part, only be heard in babies. Okay? As we get older, the third sound should not be heard. If it does, okay, then that's when hopefully, most likely, the doctors are going to do a little more investigation into what might be causing that third sound. So as we look at these, what's making up the sound,